Everyone, and thank you for joining us this evening or afternoon, depending on where you are, for celebrating Moms Healthy Babies Begins With You. My name is Karen Walker Johnson, and I have the honor of being the interim president and CEO of the March of Dimes. And I'd also like to add that I am here in California. The United States is facing today and has been facing for the past several years an increasingly dire crisis in maternal and infant health. It is an all too common refrain we hear that the United States is the most dangerous developed nation for a woman to be pregnant or for a child to be born. For years, the March of Dimes has focused our work on identifying the root causes of this condition and educating practitioners, be it doctors, midwives, etc. Expecting people and their families and the policymakers all in an effort to bend the curve and to reshape the environment in which we find our nation and where we find our moms and babies. The results have been uneven at best. Some states have bucked the trend and have led with innovation and comprehensive reforms aimed at making the needed changes. Others, unfortunately, have been lagging, and there remains much to be done. This afternoon and evening, we want to focus on one of those trend-setting states and examine how innovation is brought to fruition, how advocates at all levels, in and outside the halls of government, can work in concert to deliver for moms and babies. There is no reason, let me stress this, there is absolutely no reason the United States is not the unquestionable best place for a woman to be pregnant and for a baby to be born. The evidence is clear that the states that lead with the reforms and emphasis on maternal health are achieving the improvements we want for all expectant people. What we need is for our leaders in communities and state capitals across the nation to elevate this priority and to ensure that the steps are taken to implement the evidence-based changes and shifts in culture that will deliver on this promise of a healthier tomorrow. Today, we want to draw attention to one state that is leading and has begun to bend that curve, and that state is California. Each year, March of Dimes issues a report on the status of premature birth, as well as maternal and infant health outcomes. In our 2022 report, the United States as a whole earned a D grade. In contrast, California received a B, one of the best grades in the nation. Clearly, part of California's success has been the emphasis the state, led by Governor Gavin Newsom, has made in addressing this issue. And at the front of that work is California's first partner, Jennifer Siebel Newsom. I now have the pleasure of introducing our moderator for this evening for the remainder of the program. Stacey Brayboy, the March of Dimes Senior Vice President of Public Policy and Government Affairs. Stacey leads the March of Dimes work to drive the types of policy reforms that we are celebrating this evening in state capitals and Washington, D.C. Drawing on her experience serving elected leaders at the local, state, and national level, Stacey has developed an integrative approach to achieving policy reform that draws on the March of Dimes' deep expertise embodied in our staff and volunteer leadership, and it energizes our robust community networks to engage lawmakers in the advancement of comprehensive reforms that deliver improvements for moms and babies. These reforms include our campaign to pass the Federal Pregnant Workers Fairness Act last December, our ongoing efforts to work with states to extend postpartum coverage through Medicaid, and now the March of Dimes campaign to ensure the reauthorization of the marquee federal maternal and infant health law, the PREMIE Act. With that, Stacey, take it away.
Thanks, Karen. And thank you, Dr. Ramos. And thank you all for joining us this evening. I will tell you that today's conversation is a timely one. You know, May is National Nurses Month, Preeclampsia Awareness Month, and Maternal Mental Health Month. And of course, yesterday we celebrated Mother's Day. And so I'm excited to join this conversation and draw attention to the needs of moms and babies in our nation, but to also highlight what's making a difference and how we all can come together and replicate where there are successes everywhere. Now, let me take this time to introduce our dynamic panel. I will first introduce, let me just say, if I go through everybody's resume and talk about all the wonderful accolades, we would be here longer than an hour. I've had the opportunity to meet each of our panelists and have worked very hard and very closely with all of them. So let me first introduce to you and welcome California's first partner, Jennifer Siebel Newsom. So welcome. Thank you for joining us. Ms. Newsom is an accomplished producer of the renowned works Miss Representation and Fair Play. And she's an advocate and a champion across broad reforms in maternal health that we've been able to enact, that have been acted during the Governor Newsom, her husband's administration. Thank you so much. Now let me introduce to you our very own National March of Dimes Trustee, Tonya Lee Lewis. Ms. Lewis is an attorney, an author, an entrepreneur, and also a dynamic and wonderful advocate. She is a producer of noteworthy movie Aftershock, Crisis in the Crib, Saving Our Nation's Babies, and The Watsons Go to Birmingham. And in addition to all these wonderful noted achievements, both of our guests are mothers. So first, let me say Happy Mother's Day to both of you, and Happy Mother's Day to all of the moms who have joined us virtually.
Thank you.
So I'm going to get started because we've got some wonderful questions that we want to have for our panelists to respond and answer to. And as you have seen, there is room for you to be able to add your chats, add your questions into the chat. And so we will reach out and look at a few of those in addition to the one or two that we have here that were introduced by members of our team, as well as advocates who sent those into us as well. So ladies, are we ready to begin?
Yes.
So I will start the first question, and I will send it to you. We'll start with you, Mrs. Siebel Newsom. In the spirit of Mother's Day and the celebration, can you share with all of us what drives your passion around maternal health? We know that you're on the front line, so can you share with us what drives your passion?
Thanks so much, Stacey. Well, so women and moms in particular, we're the backbones of our families, of our communities, and of the economy. I think the pandemic shed a real light on that. And we're also the kind of emotional regulator of our family's nervous systems. So if our nervous systems are out of whack and we're stressed out, our kids are going to experience that and feel that. And I come from like a lineage of really strong women. My grandmas really were role models to me. My grandfathers had passed prior, and I saw the power of the feminine, the power and the value of the feminine, not just in the family, but in community in terms of their contributions to society beyond their family. And I've just, as a mother of 4 young children, I myself have gone through the process of having to have 4 C-sections that I was going nowhere near. I'm afraid of blood. I was pre-med in college and I fainted every time I saw blood when I worked in a that I didn't want to see blood or experience it. And so I have tremendous empathy through my own lived experience, but also just being someone that reveres women and centers women in my work around the fact that, again, if we don't value and see and uplift and support women, then we're basically signaling not only are they not valuable to us, but then that we don't actually care about our offspring, their offspring, and the future of our society. And so I'm just like a staunch advocate for all the work that we've been championing out of this office, which is related to maternal health, violence against women, women's mental health, pay equity, women's representation, because we know, again, that when women are centered, supported, and well, that their families are centered, supported, and well, and have the best chance to succeed.
Thank you very much. So now I will turn it over to you, Ms. Lewis Lee. Would you mind sharing with us what drives your passion around maternal health?
Yeah, thank you. And I'm happy to be here having this conversation. You know, for me, sort of as Jennifer said, women are the bedrock of our communities. Everyone is born through a womb. And so we know that infant mortality, maternal mortality are the markers of a health of a nation. And when we look at the United States and we see where we are, we know the United States is not doing well. And if we're not doing well when it comes to our birthing outcomes, that means we're not doing well as a nation in terms of our health. Further, when I see the inequity and the disparity, when you have Black women dying at higher rates than white women, Black women die 3 to 4 times the rate of white women from maternal mortality, that's a signal. Black women are the canaries in the coal mine. If we fix it for the most vulnerable, we'll fix it for everyone. When we look at the statistics, we see that 80% of the maternal deaths that happen in the United States are preventable deaths. And so I know that there are things that we can do to improve the outcomes for these mothers, for these infants, and for all of us, because this is really a community issue. If we are not birthing through healthy women, healthy babies, we cannot be a healthy society. This is of the most important for our nation. And so I'm just driven because I really want to improve the outcomes for all women. And I know that it really begins with closing the equity and disparity gap.
Thank you. Thank you both. So I will go to you again, first partner. We know a multitude of policies can improve maternal health. And today we're looking at some of the wonderful successes in California as a model for what states can look at to potentially consider. As you think about the success of California and the success that you all have had over the past few years, which 1 or 2 actions do you think have contributed to most of California's progress in the maternal health space?
Well, look, we're a work of progress. And I will acknowledge that we were failing Black mothers historically, and I think that we're turning the tide thanks to the California Omnibus Act. And I'm so grateful to all of you who partnered with us to make this a reality. With the $1,000 monthly stipend, the Pregnancy Associated Mortality Review Committee, improving data collection on the fetal and infant mortality review process, the funds for the midwifery workforce, the Medi-Cal doula benefit. Nobody knows about that, and it is so exciting. I just think it's one of the coolest things ever that people, even in government, are starting to realize is an actual offering now. And then again, streamlining government, reducing some of the CalWORKs paper requirements. We're in a really good place of kind of cleaning up a system that was broken and that allowed for racial disparities to persist. And then I'm also really, really proud of the reforms to Medi-Cal. So the 2-month postpartum period now being moved to 12 months. This is going to be tremendous, and it's starting to have an impact. The doula services, again, like really, really exciting. The dyadic services, I know as a mom with young kids, it's true. We were really good, and many of us, we can get our kid to the pediatrician for that checkup, but who's checking in on us? And so I think there are going to be so many return benefits to that just there. And then I'm really proud of the community health workers benefit expansion to include promotores and include those non-licensed public health workers in the preventative health services arena to promote physical and mental health, because we all know that health starts at home with how you take care of yourself, your sleep, your food, nutrition, your daily mindfulness, which increasingly I think we all need, or your daily mindfulness practice, your exercise. So again, I'm proud of California. We're not perfect. We've got to keep leading the way and holding ourselves accountable. But I think that we have enacted some policies in place that can be models for the nation, and I'm really proud of what we've done so far.
Thank you. And so, Tonya, I will turn a different question to you that has been presented. It is similarly, we know a multitude of community level and grassroots efforts can improve maternal health and outcomes. Can you share some successful efforts that you've seen and contributed to, or things that have been successful contributing to maternal health outcomes?
Well, first, what I would do is I would look outside of the United States, because the United States of America has the worst maternal outcomes of all industrialized nations. And so when you look to other nations, other industrialized nations, what we see is they have midwifery care at the center of women's health care, and their outcomes are better. That is evidence-based. That is an evidence-based situation. I think in the United States, we still have a fear of midwives, which I could go on and on about why that is, but I think what we should be looking at is how midwives can be integrated into women's health care to help women along the way. I think you talked about earlier, Stacey, about some of the issues in the Momnibus bill, specifically postpartum care, that fourth trimester care. I think what we see is when women are seen, because again, a lot of maternal poor outcomes happen postpartum, when you have the coverage postpartum and women are seen after they've given birth, right after birth, every week thereafter, we can catch some things there. So postpartum care is really important. Doula care is really, it can be a real game changer, having someone there advocating for women. That is a proven to improve outcomes. Women centering care, when women come together to share as they're going through pregnancy together. Again, I think what has happened in the United States, we kind of expect women to do everything on their own by themselves. And actually, we're supposed to come together as a community. And evidence has shown that when women come together and share the experience, that the outcomes are better. So I think there are a lot of community pieces that can really help improve outcomes and are showing to do so.
Thank you. And let me have one follow-up. It is so there's a stark reality that is even in our best states, there's a deep inequity in the healthy outcomes of Black women. How have you raised awareness on the critical issue? And I'll just a follow-up for you, Tonya.
Yeah, well, first of all, I've had the opportunity to travel the country with the Department of Health and Human Services and meet women and talk to women and hear what's going on out there. And I've been able to take those conversations to a broader audience. As you mentioned, I co-directed and co-produced a film called Aftershock. And I'm proud to say that we just received a Peabody Award for that. That really shows what it is like to experience the loss of a mother for families. And we kind of focus, surprisingly for a lot of people, on the fathers who are left behind, because they're the ones who have to raise these children. To me, I think the key is to be having these conversations, which is why I am happy we're all able to be here together, because it takes all hands on deck. This is not just a medical problem. We cannot expect doctors to solve the problem. Doctors are caught in this cog as well. So I think we all need to be at the table. We need to be talking to med schools. We need to be talking to insurance companies. We need to be talking to our local, state, federal lawmakers, talking about what kind of policies really impact the well-being of mothers and infants. We need to be talking to businesses about how they can be involved. That's the only way we solve the problem. And I think that we all have a role to play. And I'm just just, this was I had not foreseen myself to be in this position, but I was called to it. And so I try to use my voice to raise awareness as much as I can.
Thank you. And I'm listening to your comments. Congratulations. And congratulations again. And then you've got a couple of, and I'm not sure if everybody can see it, but we've got a couple of comments that were being made in the chat. So congratulations and thank you for your comments. And so First Partner Newsom, I'm going to turn to you and I want you to share with us, you've done some wonderful things in terms of advocating for reforms, both as a first partner and before becoming the first partner. Why is it important to you, and why do you think it's important to leverage the authenticity of our voices and to drive home the need for change?
Well, storytelling is key. Data does tell a story, but when you bring storytelling together with data, and you educate not just the public, but decision makers and those in power, you can move hearts and minds, attitudes and behaviors, and ultimately transform culture. And women have been rendered invisible in our society. And when we look at the gendered hierarchy as the oldest form of oppression and the template for all other hierarchies, we see that at the bottom of every hierarchy is a woman, whether she's a woman of color, a Native American woman, a Black woman, a Latina woman, an LGBTQ+ woman. It's a woman at the bottom of all the hierarchies. And so we have to tell our stories. We have to put our stories out into the world and share them and speak truth to power about how we have been rendered invisible, our experiences have been rendered invisible, and the harm that it's not just causing us, but our families and future generations. How do we expect those children to thrive if they don't have a mother? I mean, of course they're going to, and you know, it takes a village and people create villages. It doesn't have to be a birth mother, but we've done such a disservice to mothers and the feminine. And by the way, we shouldn't just be celebrated on this one day here. I was thinking about it last night. My husband, he did a beautiful job of setting a table for the kids and the kids helped. And it was a beautiful meal. I'd come back from a silly sports event with my daughter all day and my eldest, and it was lovely. And I felt so loved and appreciated, but like, that's one day, and God bless all partners. Again, women really are the backbones of our families. And so again, this storytelling is critical. And I'd be remiss if I just didn't bring up like how powerful those of you are. And I know some of you are on here. Like, I was so grateful to visit Black Women for Wellness in Los Angeles and grateful for their partnership and yours, Stacey, and the March of Dimes. And so I'm grateful too for the advocacy and the storytelling around April Valentine's death. We lost a beautiful life, undeserved, and because of racism and misogyny in a hospital. And this cannot continue. We cannot continue to have women's lives erased and terminated because of ignorance, because of, you know, systems that were not created for women and by women, but were created to kind of preserve power structures and control structures that again don't have us and our health and well-being as the, you know, most important outcome. So I think we're moving as a society. Like, I don't mean to be so doom and gloom. We clearly still have a ways to go, and every life lost is a major tragedy, and we have to see that as that. We've become too numb, and just it's become normalized that, and it shouldn't be. These are preventative deaths, and so I think when I hear that as an advocate and a storyteller, for me, it's just about sharing our stories, telling our stories. And in my position, I have this platform in which I want to be able to support and advocate and give this opportunity to other women, marginalized women, to tell their stories so that we can achieve parity, so that California can be this light on a shining hill of what's possible when you value women, when you see women, and when you support and envelop women with everything that they need to birth and raise and socialize future generations.
Thank you. Thank you so much for those comments. So I've got two more questions, three actually, before we move into another part of our segment. But let me turn my attention and my question to you, Tonya. It is, and actually this question is for both of you. So we'll start with you, Tonya. We have business leaders in our audience. We know the cost to employers are higher when babies are not born healthy or require hospitalization. As you both are entrepreneurs yourself and making things happen, describe ways that the business community can support moms, support mothers, and the outcomes of their babies.
Yeah, I think, in a civilized society, we have to support our mothers who are working. This idea that, you should give birth and then get back to work 2 weeks later is crazy. It comes from the system of slavery, where there was an expectation that a woman give birth and get back to work. And we are now all caught up in that system. One of the midwives who we spoke to in Aftershock really brought that point clear for me in a way that I didn't understand. And now I do. I think we really need to think about, family paid leave. And I know, Stacey, you worked very hard on that legislation, which was really important to make sure that women can have the time to give birth, get their bodies back together, get their bearings together, so that when they get back into the workforce, they're even better than when they got there. So I think that as business leaders, we need to really think about how we can be supporting women postpartum, especially. And I think we need to think about how we're supporting women throughout their pregnancies. What we've discovered with COVID is that there are a lot of ways that we can do things. And I think we need to be really thinking out of the box, because when we have healthy women and healthy babies, we have better workers. I heard recently, someone told me about a woman who gave birth, who had postpartum depression, who was not able to function at her job, and then was fired from her job. That is an inhumane way to treat women. In a civilized world, we should not be doing that with our women. And I think we're losing more than we're gaining, and not even fully understanding that.
And so I would thank you for those comments. I'm going to pose the same question to you, first partner, Newsom.
Well, again, as Tonya was saying earlier, we could learn a lot from European countries. I think California is trying to be the model. We expanded paid family leave. We've invested in childcare. The private sector, if they can help us do more in the childcare arena, it's everything. Childcare is it's infrastructure, right? It's critical for you to go to work. We've, invested in universal pre-K, pre and after school and summer school. We have funding for home visiting services for low-income families, increased CalWorks. The state, basically what I'm trying to say is the state's been doing a lot. I mean, trauma screenings, providing developmental screenings, expanding the child savings account. So the state's doing a lot. So we're really looking to the private sector to partner with us because yes, everything Tonya said. I mean, I know it personally from my 4 children and working and being an entrepreneur and having deadlines. It's like women need to be in a space to put their own oxygen masks on. And we know that, I had postpartum after my first, had the C-section, with multiple children. Who's driving children to school while you're recovering from your C-section? It was insane to me that we didn't go home with a prescription for physical therapy. I mean, the French do pelvic, you get a prescription for pelvic PT afterwards. And it's just insane that we just don't recognize all that women go through. And that we just expect them to, again, bounce back to work. Every Latina woman that I know who had a forced C-section or emergency C-section ended up having to have another surgery later because she, in her low wage profession, was then forced to go back to work not even 2 weeks later. So again, it's just inhumane what we've done to women, and it's highly disappointing. But again, I'm hoping that California can continue to lead in this area. Obviously, we have to balance budgets, which is why the private sector needs to create workplaces that are family friendly, where there's flex time, where there's some subsidized childcare, a recognition that a woman might need to go, her kid doesn't have school that day, or what do we do during the summer if the kid's school doesn't have a summer school program? Obviously we're not paying women enough in this country. So for the private sector, please make sure you sign our equal pay pledge, the California Equal Pay Pledge. It's ridiculous that we still underpay women, especially women of color. And yes, California has the strongest pay laws in the nation, but we're still trying to close that pay gap for Latina women, African American women, and Native women. It's again, wealth begets wealth. So without closing that pay gap, again, how are we able to take care of ourselves and take care of our families? And then again, I'm so grateful for the paid leave that we've expanded, but the private sector could really do more in terms of recognizing the benefits of retaining their female mother workforce by not penalizing them with pay penalties when they have children, but continuing to keep them at par at the same level as their fatherly counterparts. And then again, making sure that there are those pipelines to leadership for these women, because look, we've been missing from the tables of power for too long. And so therefore, the more we can focus on ensuring that women can succeed in the workplace while raising children, the better off we'll all be, because their voices need to be heard. And we need to redesign some of these businesses and organizations around our life patterns and needs. Because again, the workplace wasn't constructed with our life patterns and needs as the bearers of children. And therefore, there's some shifts that can happen if we can figure this balance out for working mothers.
So thank you for that. I want to switch. We've got time for, there are one or two quick questions. I know we have some time constraints. So I will take one that was sent over in the chat that I can see, but I don't believe that all of our guests who have joined us are able to see. But we have a question, and either one of you can take it. It's going directly to the panelists, or you both can respond. This question is from Anna Vick, and her question is, how can we get our state to follow California's model? And so I'm not sure, she didn't say where she's from, but how, and I guess I would pose the question to the two of you, how can we get other states to follow California's model? And then the most important one would probably be, what is the first step for a parent that wants to be an advocate, or a parent advocate? So if both of you could respond, we'll have that be our last question. And she is from North Carolina.
Great. Do you want to start, Tonya?
I was going to say, Jennifer, well, it sounds like she's asking about how can the state follow California? So maybe I'll let you go.
And then you can, and then Tonya, you can answer what are some first steps. Well, you're both the parents.
Be an advocate.
Share some first step. Yeah.
Yeah, I mean, I think you have to, I mean, look, we women, we're so busy, and it's like the system's so complex in terms of being engaged politically, but we have to find the time and space and community and village that's going to help us be engaged. So we elect leaders who listen to us, who share our values, and who are going to advocate on our behalf. It's so important that you advocate to your local leader and make sure that they're going to champion your values. So that's number one. And then to follow in California's steps, look, I mean, I think, Stacey, I think you guys are an incredible partner to us. And I think that you know the roadmap. And I think that they should really connect with you and follow, look at what we've done. I mean, I kind of listed, the litany, but you have the policies. I know the governors, the National Governors Association across the country is focused on maternal health and infant mortality. And so I believe that, other states have the information. It's just about making it a priority. And so what you could do, and this is in a continuation of advocacy, is speak to the first partner, first lady, governor's office, and really demand that they value women, value mothers, and value the infant, and that they address some of the disparities in the state's outcome. And we know that across the board nationally, we're failing mothers, and in particular, we're failing mothers of color. So there's a lot of work to be done. I think you just need to get started.
Yeah, I love that
Thank you.
answer because I love the, yes, March of Dimes is here and a great resource. So really appreciate that. In terms of really thinking about how you become an advocate, I would say first and foremost, take care of yourself. First and foremost, take care of yourself. You cannot advocate for anyone unless you are taking care of yourself, mind, body, and spirit. So start there. And then I would say, start person by person, start talking about the issues, hear what's going on in your community. You may already know, but the more you talk to other people, you hear patterns, you hear what's really going on, you hear, because each state, each local community has little nuanced differences. Yes, there are general things that we are all connected to, but each locality has a little different nuance. So really understanding what's happening in your community, what's important to the people there. And then again, I can just reiterate, making sure that your elected officials represent your values. Getting people out to vote. Voting really does matter, especially locally. And also, as we were talking about here, talking to local businesses, just really getting the temperature of your community, start being a sort of a busy bee, discovering what's going on, and just keep talking. Again, I can't say it enough. These kinds of conversations are really important. And it can be small, and it's amazing how quickly it can grow.
So let me thank you. We're coming to time for the first part of our webinar, but we're going to have a conversation with California Surgeon General. But let me first thank you, Tonya. Thank you, First Partner Newsom, for joining us. What I heard you both say is that anybody can be an advocate. We've got to partner with our business community. We've got to invest in our moms. We've got to look outside of the US to look at some of the best practices. I've heard you both share with us tonight, or where you were in California, to me it's in the evening, and we're across the country. So let me just say, what you've been able to share with us also is to look at midwifery, look at doulas, hold your legislators at the local, state, and the federal level accountable. Encourage them by telling your story as a parent. If this is your first time going out to be an advocate, share your story, because that's how it's able to resonate. I took from that looking at family-friendly environments for businesses, encouraging that. I also heard the two of you also highlight the partnership that we have working with the National Governors Association, and making sure that we're also talking to not only the governors, but also encouraging all of you to spend time talking to your leaders, your first partners across the country, because it's important that we do what we can to be able to help our moms, help our babies, and focus on such an important topic, maternal health, across the country. So thank you. Can everybody please join me in just giving them these wonderful, dynamic women hand clap.
Thank you.
Thank you. Thank you. Thank you.
Thanks so much for having us. So proud of you guys. Thanks for your work.
Thank you. Thank you for your partnership.
Of course. Thank you.
Take care.
So now I am going to ask Dr. Ramos to come on. She is the Surgeon General for California. And we're going to have Dr. Ramos share with us to help frame the conversation so that we all can understand the success and the work that still needs to be done in California, that still needs to be done across the country. So it's my pleasure to introduce our presenter, Dr. Diane Ramos. She is California's second Surgeon General. She's an obstetrician gynecologist who served in a number of public health leadership positions and as a leader in her profession before assuming this office last year. And in addition, Dr. Ramos is no stranger to March of Dimes. She's been a longtime supporter of our efforts in California. And Dr. Ramos, let me just say, I'm looking forward to meeting you one day in person, but thank you so much for taking time to join us, and thank you for being a supporter of March of Dimes.
Thank you so much, Stacey. It is an honor to be here on the same virtual stage as our first partner, Jennifer Siebel Newsom and Tonya Lewis Lee. As you mentioned, Stacey, I've been a longtime partner of the March of Dimes. And I just want to remind folks, yes, California does have the highest grade. And yes, we do have 1 in 8 births occurring in California. But the most important thing, as the first partner mentioned, is that we need to continue the improvement, continue the work. And with that in mind, as California Surgeon General, one of my initiatives is really looking at the disparities, improving the perinatal outcomes that we have here in California. Even though we have that B grade, we need to be better. We're always striving for that A. The A+ would be even good. So with that in mind, I want to share some of the big, bold ideas that we have gleaned and really have set forth as our marching orders, something to consider going forward here in California as to what our next steps could potentially be. So last month, we convened 17 innovative leaders at Stanford University. Now, with 80% of pregnancy-related deaths determined to be preventable, we had participants, we asked them, we need to hear bold approaches and opportunities to improve the health of mothers and babies in California. So we had a diverse group of voices, ethnic, community, business, health, and technology partners. All of them provided recommendations for patients and healthcare. We had a diverse group of people. Recurrent themes emerged, and very similar to what you heard previously, and that is focusing on trust, patient partnership, and innovative and high-tech healthcare delivery models. And this is really important because if you think about it, we're here in California where we have the home to Silicon Valley, Silicon Beach, a lot of innovation. So the results were focused on really with the patient that there are several diverse ideas and strategies that were brought up, but there was unanimous agreement on the importance and benefits of centering patients. Tonya brought this up earlier. Community partners highlighted the fact that patients often do not feel heard and do not trust medical providers. So establishing trust was identified as a critical component in improving the patient healthcare partnership. Participants noted that without trust, there is hesitancy by patients in communicating and establishing a relationship with their healthcare provider. But once trust has been earned, health information is better shared and received. An active engagement in decision-making can occur. Additional recommendations focused on cultural competency in communication. How you communicate is just as important as what you communicate. And healthcare providers need to take time to understand the cultures of the communities they serve. Helping patients communicate their health challenges and concerns is important. So one strategy discussed was to develop a list of questions that patients may want to ask their provider during an appointment. And this list could be posted in the waiting room, exam room, or even shared in the appointment reminder or email or text that we receive right before an appointment. One solution to improving and establishing trust also included the leaders in the healthcare system intentionally acknowledging well-founded historical trauma and mistrust of Western medicine. Another recommendation was identifying and utilizing trusted messengers from the community, such as doulas, community health workers, and promotoras. And this is what you just heard. These messengers are bridges to establishing trust and navigating healthcare. And trust can also be improved in providing care where people are, instead of having people travel to obtain care outside of the community. So some options to consider were bringing care to the community, such as telehealth, mobile services, in places of trust in the community. Other recommendations were libraries, places of worship, community locations where people naturally congregate and feel comfortable. The beauty about all of the doulas and the community healthcare workers and promotoras is that here in California, as the first partner mentioned, we are already funding that. So that opportunity, that option is in play. Now, with the healthcare setting, provider bias was identified as a contributor to disparate patient care. And we heard this earlier. The Obstetric Comorbidity Index, or OBI, is a validated checklist that was presented as a potential tool to use because it identifies risk while in labor without any potential provider bias. So this OBI has been described as an APGAR score, which is what we use for newborn babies, but for moms. The group highlighted the importance of identifying potential patient risk before pregnancy, during pregnancy, and after delivery. So predictability models, such as the OBI, can be completed by providers in the electronic medical record and through artificial intelligence. If developed and utilized, a patient self-assessment version of the OBI could alert a patient or their potential pregnancy risk. So this is something that a potential pregnant person can do even before they become pregnant. So depending on their reproductive intentions, the OBI results can be paired with information on the next steps. So that could be following up with their medical provider if they have high-risk medical condition before they become pregnant. Early risk assessment has the potential for earlier intervention and improved health outcomes. And data suggests that 90% of pregnant women utilize technology, such as pregnancy apps. So other ideas shared included leveraging technology, such as at-home monitoring for patients. And one example is the text-based postpartum blood pressure monitoring. That allows patients to track and report their blood pressure well in advance of their next office visit. But it's important to note that while high-tech tools exist, equitable access does not. So that is one area where we need to work on. And with the knowledge that about 33% or 1 in 3 maternal deaths occur after delivery, suggestions to improve maternal mortality should focus on ensuring postpartum care. So newborn child visits are oftentimes kept more often than the maternal postpartum visit. And this was mentioned earlier. Dyad care was suggested. In a dyad care model, the newborn and postpartum mom are seen together, leveraging the touch points of a baby's first doctor's appointment to benefit the new mom. And additional suggestions highlighted the need for structured communication and health education delivery tools. Providers are not trained on health education communication and cannot solely be responsible for providing that health education to patients. So discussion was focused on the need to engage health educators and communicators in developing plain language health literacy fact sheets and talking points that can be shared not only with medical providers, but with anyone who is interested in finding out more about those healthcare improvement opportunities. So key takeaways from the roundtable are gathering discussion focused on building patient trust, ensuring patients are active participants in healthcare decision-making, and identifying risk assessments on a variety of levels of care using a wide range of modalities. And several intersections and opportunities for cross-collaboration emerged. And that's one of the secret sauces, our salsa here in California that has made us successful, is that cross-collaborative partnerships with the medical, the community, and really all of the public and private partnerships. Now, this included incorporating also including technology and artificial intelligence to the work that's already being done in the perinatal improvement arena. So really elevating that and building a diverse representation of community health workers, such as doulas, who are trained to not only build trust, but to support and advocate on behalf of the mothers during pregnancy, childbirth, and postpartum period. So my office, the California Office of Surgeon General, we will continue serving as that convener, as that voice of diverse and innovative thought partnerships across the state. I am so grateful to everyone that participated on there, and I'm happy to report that the March of Dimes was one of those partners that was at the table with us. So we will be going forward and helping convene and helping be at the table of that leadership and the next steps. Thank you, Stacey, for giving me the opportunity to share that many of the things that have been recommended, California is doing already, and we're just trying to go to the next step and make things even better, not just for Californians, but really for all moms throughout the United States, because we know as California goes, so does the rest of the nation.
Thank you, Dr. Ramos. We really appreciate your comments and joining us this evening. I also want to just make sure that I thank Karen Johnson for helping do our introductions and also joining us, as well as our first partner, and Tonya Lee for joining us as well. So I want to just share with everyone who's joined us and our invited guests and listening today to continue the I'm asking you all to continue the conversations in your community. Be the driving force to bring that much needed change and reform in your state and in your community. I mean, March of Dimes wants to work with you, reach out to us. We want to do our part. We're now concluding our webinar, but I want to just, I would not be who I am if I didn't end it by asking you all to do a call to action. And it's real simple. You can lend your voice to healthy moms and healthy babies by doing a texting for us. So we have been pleased and honored to know that the reauthorization of the Preemie Act was just reintroduced on Capitol Hill. And so what we need all of you to do is just text. That's right, pull out your phones and text 52886. And what I want you to text when you put that in your phone, texting to 52886. I want you to type in Preemie, and that's Preemie. And that is for the Preemie Act. So again, text Preemie to 52886. And just want to let you know, when we close out, there's going to be a survey that is going to pop up on your screen. I promise you it will take no longer than about 2 minutes. And I have been asked to make sure we stay on time. And so I hope you can join me in thanking the great team for pulling this webinar together. Thank you for your support of March of Dimes. And again, together we can do anything. Thank you.